Thank you for tuning in to Flick News Network. I'm reporter Tasha, and tonight we have an interesting story on a virus that many of you may not know. Let's tune in to Dr. Hannah Flick with St. Petersburg College for this story.
Shingles is a viral infection that causes a painful rash. Shingles is caused by the varicella zoster virus, the same virus that causes chickenpox. After you've had the chickenpox, the virus lies inactive in the nerve tissue near your spinal cord and brain. Years later, the virus may reactivate as shingles. Back in the day, moms and dads would get their booster from their children when they received the chickenpox. But now that children are getting vaccinated for chickenpox, parents are no longer getting their boosters. Reason for this virus is unclear, but it may be due to lower immunity or a weak immune system. The varicella zoster is part of a group of viruses called the herpes virus, which include viruses that cause cold sores and genital herpes. Because of this, shingles is also known as the herpes virus. But the virus that causes the chickenpox and shingles is not the same virus responsible for the sexually transmitted infections called herpes. Symptoms can include pain, burning, numbness, and tingling. A red rash that begins in a few days with a little bit of pain. Fluid-filled blisters may break open and crust over. Itching also may occur. Some people also experience fevers and chills, headaches, and fatigue. The pain is usually the first symptom of the shingles for some and can be very intense, depending on the location of the pain. Some people experience shingle pain without ever developing a rash. Some treatments are vaccines that can help reduce the risk of shingles, while early treatment can help shorten a shingles infection and lessen the chance of complications. There is no cure for shingles, but prompt treatment with prescriptions, antiviral drugs, can speed the healing and reduce your risk of complications. These drugs may include acyclovir, valacyclovir, and famciclovir. Are you contagious? A person with shingles can pass the varicella zoster vaccine to anyone who isn't immune to chickenpox. This usually occurs through direct contact with a person with open sores of shingles rash. Once infected, the person will develop chickenpox, however, not shingles. Chickenpox can be dangerous for some groups of people. Until your shingles, blisters, scab over, you are contagious and should avoid physical contact with anyone who has a weak immune system, newborns, or pregnant women.